On SON Breaking News today, we dig deep into health and welfare in Leon County. Public health officials have found new evidence that chronic heart disease is the leading cause of healthcare related deaths in Leon County since 2012, with obesity not far behind it, leading in chronic conditions. We will take you live through Leon County as SON investigators assess, plan, implement, and evaluate these current pressing community issues. Leon County is a 21-city community where college students, policymakers, migrant workers, and many other residents call home. Leon County is also home to the state capital, Tallahassee, where changes in the state legislature happen every day. But are the health concerns of the community being met? Is there affordable care with assistance programs available to those who do not have reliable primary care? What is being done for those less fortunate in our community? Very similar to the national average, Leon County's top 3 major causes of death include heart disease, cancer, and stroke, each of which have different risk factors that can be decreased by the community through health promotion, education on nutrition, exercise, and much more. Live in front of the Eternal Flame, investigator Stevie Roberts reports more on this matter. Heart disease is the #1 morbidity in Leon County according to the Florida charts. What are some risk factors for heart disease and how can people in the area prevent it, Stevie?
Okay, well, CDC actually says that over 600,000 people have died from heart disease each year. Some risk factors for heart disease would be smoking, unhealthy diets, and not exercising regularly. So what we can do for patients that have heart disease is ask them to exercise regularly, at least 30 minutes a day. We can ask them to have healthier diets such as fruits, vegetables, and make sure that they are a part of programs that can help them. So reporting live, back to you, Sharon.
Leon County is comprised of 21 cities, each of which have their own health resources. These resources can range from mental health care facilities to private hospitals, doctors' offices, and surgical centers. Throughout this program, they will be featured to help healthcare officials and citizens alike to gain insight on what healthcare in Leon County looks like. Leon County Health Department identified obesity as the major health problem plaguing its citizens, but there are ways to get active for all ages. Investigator Ashley Miller is live with more information on parks and recreation available to its citizens. A major issue amongst Leon County citizens happens to be that people aren't knowledgeable about the different opportunities to become active in their areas. They either don't know about these recreational areas and parks or can't access them. Can you shed some light and provide information on this matter?
Yes, thank you, Sharon. According to the Leon County Community Health Plan for 2012 to 2017, the major health issues identified for Leon County was obesity and chronic diseases. To improve this plan, they use many strategies such as providing health promotion and materials to parents about different opportunities throughout Leon County in pediatrician offices and schools. According to the Leon County Parks and Recreation, they have over 200 community centers located throughout Leon County. That's Ivan, Woodville, Miccosukee. And many of these centers offer a lot of intramural sports such as basketball, volleyball, different ping pong, and different activities to get children out of the house and into the community exercising. For 150 other community centers within Leon County provide services throughout the summer to children for free. Children tend to gain more weight in the summertime, so therefore these community and parks and recreation centers are free of charge to these to lower income families. Recreations offers transportations to and from the community park. They start as early as 7 a.m. in the morning all the way to 6 p.m. at night. Our goal would be to provide parents with more information and more opportunities in the area to get the word out that this is a community center and this provides free This is a free access center for children. This is Ashley Miller reporting for SON. Back to you, Sharon.
As Ashley previously stated, the resources available are not lacking. The knowledge about those resources is the problem. After the completion of the community assessment tool and reviewing records kept by the Leon County Health Department, Florida Charts, and the Census Bureau, 2 community NANDAs have been selected. The first being ineffective health maintenance related to presence of adverse personal habits. It is our objective as public health nurses to have the client verbalize their intent to engage in health maintenance behaviors. Each intervention is carefully laid out with rationales that assist with understanding the client's specific needs, and step-by-step implementations guide the public health nurse towards their favorable outcomes. Health and wellness are not the only concerns here in Leon County. Welfare is a subject worth mentioning that ties into the maintenance of your community. For those less fortunate than others, welfare are the available services that are offered at a cheaper rate or no cost at all. To those in need who qualify, find out where some of these resources are located. SON investigators will be addressing this issue.
We are now reporting live on the steps of Lee Hall, where Xaviana Pickens will be telling us more about welfare services that are available in Leon County. Xaviana?
Yes, Sharon. The first service I'll be talking about is a housing rehabilitation service, which is offered to low-income, very low-income, and extremely low-income individuals. Individuals who are 62 years and older, individuals needing or who need special housing, and also households with minor children. The goal of the service is to offer safe and clean, affordable housing for low-income individuals. Another welfare service offered by Leon County is a service by the name of CareNet, which is a primary health care service offered to those under and uninsured individuals living in Leon County. It's a public and privately owned partnership that offers health care services to those residents. Bond Community Health Center and Neighborhood Health Center are the 2 primary care providers. They offer services on a sliding fee scale based on the individual's income. There are many other organizations under the CareNet service, and that includes FAMU Pharmacy, Leon County Health Department, Kid Care, WIC, and We Care Network. More welfare services can be accessed at leoncountyfl.gov. This is Xaviana Pickens reporting live for SON. Back to you, Sharon.
The question of the day is, can Leon County become a moving community for the better? And how do we help and take action? Our second NANDA refers to the inactivity of Leon County citizens as a whole, ineffective self-health management related to failure to take action to reduce risk. Our objectives will focus on demonstration, allowing the client to be an active participant in change, while our interventions will assess their current knowledge status and teach new ways to change habitual behaviors. And in order to do so, we must provide the client with the community resources available to them. Leon County does have strengths pertaining to health promotion and planning. The Health Department has published a public health manual, Leon County Mobilizing Action Through Planning Partnerships. Unfortunately, most public health officials are unaware of such a publication, but it could be beneficial to agencies such as Neighborhood Medical Center, Bond Community Center, and Big Ben Cares. Leon County, having a diverse group of residents, still also has its weaknesses. Some individuals still don't have equal opportunities for health and wellness. Our SON investigator takes a closer look at what might be obvious signs of adverse situational circumstance.
Why are impoverished and low-income areas more at risk for heart disease, AB?
The low-income people are at risk for heart disease because healthy food are very expensive in markets. So people tend to buy something that is not expensive at the same time that can cause a lot of cholesterol that can lead to heart disease. That's one. Two, people that are low-income people live in a very dangerous area. They don't go out that much, and that's inactivities. Inactivities, when you are not active, can lead to heart disease. This is AB reporting live from SON. Back to you, Sam.
Thanks for watching this breaking news report on Leon County's health and welfare. Tune in on December 2nd for the official coverage of the graduating FAMU School of Nursing class of 2015. For now, I'm your host, Sharon Slack, and we'll see you next time on SON Breaking News.
The other service that I'm going to talk about is the healthcare services provided by Leon County. It is called, I don't want to say that. Okay.
Reporting live.
Okay.
Heart disease is the #1 morbidity in Leon County according to the Florida charts. What are some risk factors for heart disease, and how can people in the area prevent it, Stevie?
Well, Miss Sharon, according to Centers for Disease Control, 600,000 people have died from cardiovascular disease.
There was a bug!